Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do is I just perform cosmetic or aesthetic plastic surgery. I do a lot of rhinoplasties in my practice, and I do a whole variation of different backgrounds. You know, I have Latinos, I have African Americans, I have Caucasians, I have Asians, and it really is a pleasure for me. Doing rhinoplasty is one of my favorite procedures, and a lot of people come in and they really don't know how to ask this, but really, Dr. Shapiro, what is an ethnic rhinoplasty, and how is that different than a Caucasian rhinoplasty? And first of all, I think to answer that, we kind of have to understand that each individual is different, and each person has different anatomy. And I think that the whole concept of beauty is different for everybody. I think that there are standard views of what beauty is, but really it is in the eye of the beholder, but also beauty is in the mind of the beheld, which means that I want you to feel like you look beautiful. An ethnic rhinoplasty is one that deals with your specific anatomy. There are different anatomical characteristics of somebody who's Caucasian or African American or Latino or Asian. Everybody's anatomy is different, though that each ethnicity has a standard anatomical difference versus one another. I think it's important to go to somebody that's very experienced in doing rhinoplasties to get an idea of what they can do for you. I think that an ethnic rhinoplasty is very important because we want to preserve your ethnicity. I know it's very important to make people look as though they are still themselves, but to make some changes that make someone appear more beautiful. And to do that, I look at the face completely. I look at your forehead, your brow, I look at your eyes and your jawline, and we try to make the nose appear like it matches, like it's the nose that you were really born with. There's a whole process that I go through when I see somebody, either for an ethnic rhinoplasty or Caucasian rhinoplasty. I see you, I examine you, we talk about what you're looking for, and then importantly, I take photographs in the office. I will image those photographs, giving you an idea about what I think should be done, but as importantly, I like for you to bring in some photographs of noses that you find attractive. Not specifically that I'm going to put those noses on your face, but I need to find out what your taste is like, because the most important reason, some of the most important reasons why people are not happy with their rhinoplasties are either the plastic surgeon really didn't do what was intended, or there was lack of communication. I feel very lucky that I performed many rhinoplasties and my revision rate is very, very low. So I think I have that covered. I try to cover this communication issue because I see you many times, so we come up with a game plan. I think you should be really part of the whole plan surgically and very intimately involved, so we get an idea about what you're looking for, what I think I can deliver, because I don't think anybody likes surprises. So ethnic rhinoplasties are a real love of mine because I think it's artistic. I think the secondary benefits psychologically are just unbelievable, and I'm very proud that one of the happiest times in my practice is when I take off somebody's splint and I show you what we've done, and many times I have patients that are crying because they're just so happy. I think all in all, to get an idea about what I can do for you is to come in for a consultation, bring in some photos of noses that you like. We'll take those photographs, we'll put them into a whole equation. I'll take photographs and image you, and we'll get an idea about where to go from there to come up with a plan that really kind of meets your expectations, but hopefully exceeds them. Thank you very much.